we're just going to quickly go around the horn to our different panel members so that they can introduce themselves, explain what their job is in the military, as well as what their job is on the outside. So with that, Colonel Pooran, are you on the line?
I am. Good afternoon or good evening. How are you doing?
Excellent. Tell us a little bit about yourself, sir.
So good evening, everyone. Connecticut, glad to be here with you. I'm the state air surgeon, Colonel Desena's counterpart on the air side. In my civilian life, I'm actually a critical care physician. I'm actually headed to work, so I apologize, I'm in the car. I have been dealing with the COVID pandemic from an ICU perspective since it really kicked off back in March. And our group runs the COVID hospital for the University of Maryland. And so on a given day, we take care of about 100 ICU patients who all are infected with COVID-19 and pneumonia and the ramifications of that. So the prospect of the vaccine and being able to get that to our fellow citizens, to be able to really get ahead of this pandemic is an awe-inspiring thought. I was one of the first ones in line to get it. I'm still here to talk to you and doing quite well. So thank you all for having this session. I really hope that we can encourage everyone to get the vaccine.
Thank you so much, sir. Greatly appreciated. Let's go now to Major Johndro.
Hi, thanks everybody. I'm Major Charles Johndro. My military life over my 23-year career of enlisted service as a medic and now as a physician at the 103rd has been fantastic. So glad to be here on that front. In my other life, I'm a civilian physician at Hartford Hospital in the emergency department, working closely with Keith Grant and the rest of the folks that you're going to talk to soon. It's important for me to be here in a few ways. As Colonel Desena said, I feel like this is our opportunity to advocate for the protection of our service members. And I feel like that's my duty to do. And so thank you for having us. Look forward to the conversation.
Thank you, sir. And since you mentioned him, Mr. Grant, I'm surprised that you're able to join us, but could you introduce yourself if you're willing to take questions?
Yeah, absolutely. So my name is Keith Grant, or Captain Grant, which is, still my favorite role. Was with the 103rd for a very, very long time as a medic, and then now with 439th AMDS, specifically in flight medicine as a provider. Civilian world, I'm the Senior System Director for Infection Prevention at Hartford HealthCare, also Vice Chief for Infectious Diseases, Chief for Epidemiology as well. I'm also serving on the Scientific Advisory Board to the Governor for COVID and other things as well. Also a member of IDSA and Chief Advisor in the state of Connecticut as well.
Thank you very much, sir. We greatly appreciate you being here. Captain Zell, can you introduce yourself?
Sure. Thanks for having me. So I'm a physician in the Connecticut Army National Guard. In my civilian career, I am an occupational and environmental physician down at Yale School of Medicine. I do a lot of research with COVID-19, specifically around antibodies as a whole, but also involved in the Governor Lamont's Reopen Connecticut initiative as well, working on the testing and authorization for labs to partner to do testing around the state. And I've been working with the Connecticut Guard since the COVID-19 pandemic started.
Thank you very much. Thanks for being here. And certainly not last but not least, Sgt Major Trouerntrend, can you introduce yourself?
Sgt Major Trouerntrend. I am the Force Health Protection NCOIC for the 118th Medical Battalion. My background is I spent 17 years with the American Red Cross doing infectious disease epidemiology. So that's kind of my background there. Currently, I'm working with the Connecticut medical team addressing COVID